Hi guys, welcome to the pharmacy. Follow me to doing a consultation. Welcome to the consultation room. I am going to take you through this screen recording of how I do a private consultation. I do utilise a tool called the AnyRx Clinical Consultation documentation tool, and it really helps to kind of guide my consultations and allow me to have appropriate documentation, safeguarding, and all of those really good things. So let's go. Obviously today you can use any kind of consultation platform, but I'm just going to show you this on a normal text box writing platform online. So let's take this website for example, and what we're going to do is so now say we've got our consultation platform. I'm just using this website for now to kind of show just you can use any text box. So obviously I would call the patient in, find out what their reason for coming in is, and then take their details, so their name, date of birth, address. If it's an NHS consultation, the NHS number. If not, you don't necessarily have to take that, but you can. You can always also use it with their consent to check their summary care record. Once we're on this page and the patient is sitting, I will access the consultation template. So clicking on this, and as you can see, we've got find a template, create a template if you need to send for some new ones, and then a news calculator if you need. So say for example today we're going to do a consultation on a UTI, so it's there. You can search for it if you want, but generally I know it's on there, so I would go to this page and do /UTI. So we've got our consultation template coming up, and then I would go through the questions with the patient. So when did it start? What kind of symptoms do you have? And as the patient relays their information, I would then kind of fill in, the information. So for example, 2 days ago, burning, stinging when urinating, yes. Increased frequency, yes. Cloudy, smelly, fever. This part on pyelonephritis is really important, and then to really ascertain how far the symptoms are and whether they need to be signposted to another kind of place, for example urgent care, A&E, 111, depending on the severity of their symptoms. If there are no red flags and you're absolutely happy with everything, you can continue down to gather more information. So their past medical history, whether they're pregnant, if they're female, and on any regular medication, and continue. And as we go down, we can see that this continues to give further information. For example, closing off the consultation, so no red flags, no concerns. You'll discuss you suffering with UTI, and then you can add into this, as discussed, I am going to prescribe you nitrofurantoin, or whatever antibiotic you deem appropriate, and then continue. And as the additional advice is at the bottom, it will have drink plenty of water, seek urgent care if you feel severely unwell. Thank you for following me on going through this urinary tract infection consultation. I hope this really helped. Let me know if you'd like me to go through anything else, and yeah, thank you for watching. Please subscribe. Thank you. Bye.